Hi everyone, I'm Victor Bian, co-founder and CEO of Allay Health. We're a Seattle-based digital health startup on a mission to improve the millions of lives living with gastrointestinal conditions. Recently, I had the opportunity to sit down with one of the Allay Community members, Regan Gallo, to discuss her life as an inflammatory bowel disease patient. Regan took us through the battle she faced since she was first diagnosed with ulcerative colitis at the age of 4. She went on to overcome the various challenges of growing up with inflammatory bowel disease, recently graduating from University of Washington here in Seattle and starting her career in the technology industry. Regan has been actively involved in the Miss America organization, and this year she is selected as Miss Pierce County. As part of her efforts running for Miss Washington, she is building a social campaign raising awareness in IBD as well as the chronically ill patients. We hope you enjoy our conversation.
So hello everyone, I'm super excited today to be joined by Regan Gallo. Regan is an IBD patient and has a very exciting story, and I'm super excited to interview you today.
I'm excited too.
Yeah. So why don't we get started by having you tell us a little bit about yourself, things like who you are, where you're from, what you do career-wise and hobby-wise. And certainly we'd love to hear a little bit more about that story with IBD, what form of IBD you have, when you were first diagnosed, and where you are currently in your treatment journey.
Yeah, well, hi everyone out there. Again, Victor, thank you for the introduction. My name is Regan, and I am a young professional in the greater Seattle area right now. I am an IBD patient of ulcerative colitis. I've had ulcerative colitis since I was only 4 years old, and I will be 24 this fall, so almost 20 years. And right now I do work in a tech startup here in Seattle. I am in software sales. So that's what keeps me busy. In my downtime, I compete in the Miss America organization, and I'm able to really connect with people with IBD with that platform. So those are some of the things about me that keep me busy, but I'm excited to be here and talk more about IBD and kind of get to know the community.
Fascinating. It's always interesting to me knowing that you were first diagnosed with ulcerative colitis at age of 4. It's such a young age.
Very young.
Yeah. Could you walk us through the story of diagnosis back in the day?
It was crazy. Sometimes I don't remember it all because I was so young. But really what happened was one day, and I wasn't really cautious of it, but there was blood in my toilet bowl, a lot of it. And I went to mom and dad and said, I have no idea what this is, what's going on. I was only 4 years old, and it probably was happening prior, but I just had no idea that was a bad thing, being 4 years old. And we rushed to the hospital, Mary Bridge in Tacoma, Washington, and I had to have a blood transfusion from my own dad because I had lost so much blood. They didn't know if I was actually going to make it. So that was traumatizing later on when I thought about it. But when I was so young, I had no idea. And so that was really hard. And I was in the hospital for my 5th birthday. Went into remission for about a year and then got sick again around 6 or 7 years old. So it was a turbulent 3 years of that first diagnosis.
How did you, and I mean, maybe you still remember, maybe you don't,
Yeah.
but how did you personally and your family respond to the information that, you have IBD and obviously you will be chronically ill?
It was hard. So IBD is actually something that runs in my family, not in my immediate family, but I have a grandmother who doesn't have a colon anymore, and I have some cousins who have Crohn's. But for my family, no one else was diagnosed. I have 2 brothers and both my parents. They neither had the experience with it. And now what I push for is being proactive and about learning about IBD because they were parents who knew people with IBD but didn't know how to take care of their own kid when it happened. And that was hard because they had to learn just as much as I was learning and be a caregiver to a 4-year-old more than what a normal parent is. So balancing that for them as young parents and for them to continuously learn, but then understand that they're gonna have to be a caregiver for a long time was definitely a battle.
Yeah, that's a fascinating story. I'm wondering, from your perspective, did you ever develop a feeling, at one point that, I'm going to be a little bit different from the other kids or the other people?
Most definitely. I always wondered, out of my family of 5, why me? Why? Why was I, blessed or cursed, whatever you want to call it, with ulcerative colitis? I asked myself that throughout all my formative years growing up, and it definitely hit later, in secondary school when you're trying to fit in and there's that peer pressure and you have this disease to think about all the time. So always I thought about, why me?
I see. Did you ever sort of develop a system to support you, kind of get you through that? Obviously at a super young age, what was that initial thing look like?
I think for me, my parents were super involved in my health, and they always wanted the best for me. So having that family support was always there. I think when you're going to school and you're being a kid, it was learning how to navigate, how to have conversations with teachers or with your peers at such a young age still, maybe at 12 or 13. And some people were able to understand it, others were not. And I kind of had to just take that with a grain of salt, me being so young as well. Mm-hmm. And learning that not everyone's going to understand what you're going through. And you're having adult conversations with your doctors that kids are not thinking about at all. And they won't be thinking about for years because they're just normally healthy. So that was kind of a reality that I had to go through, especially when I got into secondary school at that young age.
Fascinating. So when did you start to realize that I could be basically the same as everybody else? I could still go on and lead a very positive life. When did that come in?
Probably around 14 or 15 years old. At that point, I had been diagnosed for about 10 years. Mm-hmm. And, you are becoming a teenager, you're getting a little bit older, and I realized, okay, I don't want to be just a patient anymore. I want to learn more about this disease, but also others around me that might have it. At that point, I was still really lacking a community with others that were going through the same thing as me. And I actually started volunteering at the local hospital in Puyallup, Washington, because that's where I'm from originally. And that was my first step into being not just a patient, but learning how nurses and doctors give to their patients. And it gave me an idea of kind of their view lens of how they look at patients. And I was just doing very basic things in that hospital, cleaning after everyone. But it was my first step at 15 years old to be like, I want to do more because this has affected me, and now I want to give back.
IBD has a lot of symptoms that could sometimes be very debilitating. Mm-hmm. And changes around you could be a huge trigger for that. But growing up, change is such a perpetual theme while you're growing up, and certainly being an IBD patient. What are some of the challenges that you encountered growing up with IBD, and how did you manage that?
It was hard to manage because you're still a child going into teenage years. So when I was about 15, 16, I wasn't responding to medication. And a big diagnosis population for chronic diseases like IBD is during that young adulthood or teenagers because hormones are changing, and that was exactly what happened to me. I was going through puberty. Nothing was responding. We went through doses of prednisone, and still I was not feeling healthy. And we decided, okay, the next step is to go on Remicade, have that infusion drug. And that's hard. That's a hard realization when your body is basically telling you this is not working. Your doctors are telling you this is not working. We have to go to this next step. And I remember being in the children's hospital just like crying when the nurses came in with the brochures to talk about Remicade, and knowing that this is going to be 6 to 8 weeks, every 6 to 8 weeks of your life for who knows how long. And there's going to be nurses coming into your house. There's going to be, side effects of an autoimmune, or immune suppressant drug, which what Remicade is. And that was a domino effect because the more infusions I had, the harder it was to, fight off a common cold. I even I had shingles at the age of 15 on this side of my face because my immune system was weak from that immune suppressant drug. And that was really hard to balance. And how do you explain hey, I'm in high school and I can't go to the Saturday morning track meet because I have my infusion on Saturdays. That was something I always had to navigate, and people were like, infusions? What are you talking about? And for so many kids who are very healthy day to day and don't even have to think about what their body's doing, I had to really figure out how to communicate that. And a lot of times being young, I just kind of did it in a humorous way because I was trying to cope as well, and no one really understood it. And now I feel bad that I did that to myself, but that was my high school era, and I was on that drug all the way through 21 years old. So I took that to college with me. I had people come into my dorm in my college apartment for my nurse to do that infusion. So balancing college as well with that infusion drug was a whole new chapter that was also even harder to do.
Yeah, that definitely is a part that I'd love to double click on because, you know, going to college, and I know that you went to University of Washington, you recently graduated here in Seattle, and, you know, that's a fascinating story because that's probably the first time you left your family and start transitioning to being, you know, taking care of yourself, your own condition. Help us, like, you know, understand what that journey looked like.
It was important for me to still be close to my doctors here in the Pacific Northwest region, and I could have gone to school out of state or on the other side of the state, but I wanted to be close. And being at the University of Washington in Seattle, I was really close. You know, now my doctors are in Seattle. I aged out of my children's hospital, and now I was the one taking myself to those doctor's appointments between college classes. But I think the hardest part for someone with the chronic disease entering college is your whole care routine is totally wiped because you're in a different environment. You're maybe in a dorm room or an apartment. You're not in the home that you're used to, and there's people around you all the time. And they don't have maybe your best interests at heart, just like your parents maybe did, or your family members. And I had a really hard time with living in a dorm with a roommate who maybe didn't understand what this disease implicated for me. And I decided my second quarter to get my own dorm room. And that was a process because the University of Washington, like many universities, are huge and they have totally different offices for different things. So here I was trying to go to the disability office to get, you know, dorm accommodations, but also I had to go to the housing office to get dorm accommodations, and the two offices don't communicate with one another. And so you're hearing different things all the time, and now this is a 6-month process to get either the room or the classroom accommodations I needed. And once I went through that, I realized that was really hard. And I remember you have to keep calling, you know, people at the university multiple times for them to, you know, follow through or just make everything in check. And my second year into University of Washington, I decided I want to help others because I'm probably not the only one living with IBD on the University of Washington campus. So I kind of created this club with one other friend of mine that sole purpose was to create a community for them with IBD, but also get those classroom accommodations or get those room accommodations, because unless you know where to go on the university to get those resources, it's really hard to find and it's a long process.
How long did you run that student club?
2 years. It kind of fluttered out because of the COVID-19 pandemic, which was really hard, but it was 2 years. And we even had students drive from the Bothell campus, like on a Tuesday night, because we met at like 6 o'clock on Tuesdays or Wednesdays, and come just be able to talk in a room together. And it was just a really cool shared space where we're all going through college, we're all going through the same classes, but we're all going through the same health issues. And we're all, you know, ages 19 to 25. So it was a really cool few years that we were able to spend time together before COVID-19 to kind of understand how else is everyone handling this.
Yeah, I'm super curious. How did COVID-19, that, you know, how everything kind of the world is used to just changed overnight? How did that, you know, work for you guys? I mean, for you and, you know, the rest of the community, I guess, with IBD. Like, what are some of the specific challenges you see there?
Not a challenge, but something that I was kind of like, whoa, this is kind of cool, is with COVID-19, it brought this new visibility to people that are immunosuppressant. like
Yeah.
a lot of people with IBD. And that was the first time I had heard outside of my household or outside of my doctor's office, people talk about immunosuppressant people. And I really actually appreciated that because it's happening to so many of us in the world, in our communities, but you just don't see it. So that actually was kind of a positive thing I thought happened with the COVID-19 pandemic. Now, I know a lot of people were worried, medication sometimes helps us or hurts us. And everyone was very worried, how is the vaccine going to affect my body, my ulcerative colitis or Crohn's? And so that was a conversation among a lot of IBD patients. And now with a lot of research, my doctor, is totally, hey, you're safe to get the vaccine, you're totally fine. But there is that moment of hesitance I had because I've been on medications that have hurt more than help. So for a while it was like, I just want to make sure I'm safe and my body doesn't flare. So I know a lot of IBD patients were juggling that for the first year or so of COVID.
Yeah, absolutely. So we've been covering a lot of your past so far, and I love to kind of shift the focus to the present. And well, it's always fascinating to know that you're in the Miss America Scholarship Program.
Yes.
I only recently got to know more about the program through you. Lots of interesting stuff. So, by the way, congrats on becoming Miss Pierce County.
Thank you.
That's a very big achievement. I'm curious, what made you decide to go into this in the first place?
So again, yes, the Miss America program, the national program, it's the largest women's scholarship provider in the United States. And I entered as a teen about, 6 years ago now, and I loved it. I loved being on stage, but that first go around, I realized it was way more than that. And the Miss America organization, every title holder has to have a cause that they are passionate about and they're bringing to the community. And they call this a social impact initiative. And mine was just very natural to me. I, was diagnosed with ulcerative colitis at only 4 years old. So I decided I'm going to bring this to community and bring visibility not only to IBD patients, but all chronic diseases because we are all living very similar lives being diagnosed with a chronic disease. And so now I was crowned as Miss Pierce County in February of 2022. So just a few months ago, I competed and there was lots of young women vying for the title, and I came out and was able to walk away with it. And now I am going to compete for Miss Washington in just a few weeks. And I'll be able to speak on the importance of making the invisible visible, advocating for those with chronic disease, especially ulcerative colitis and Crohn's, because it's not only about ensuring that I can advocate for others, but also teaching those who maybe haven't lived with this disease too long or are a new caregiver, how can they be an advocate for their patient or themselves in the community when others don't really understand what the disease is. And making sure they have resources like the Crohn's and Colitis Foundation or Allay Community, or just ensuring that they know where they can get support. And also from a preventative perspective, chronic disease is very environmental a lot of the times. And I want to make sure that, what are we doing right now that is going to promote our health in 10 years? Because I have been able to manage my disease by doing preventative things in my day-to-day that help my gut health and help my overall mental health and well-being. And I want to make sure other people are taking those steps so they aren't diagnosed with chronic disease down the road. So it's all of those things packed in one.
Yeah, that's super interesting. I mean, I'd love to kind of talk a little bit more about the how you kind of advocate. What are some of the measures that you've taken to really advocate for this community? But I'm also really curious about how you kind of prepare for Miss Pierce County in the first place. How did you win? And certainly being, managing your condition, also kind of, I guess, in school, or maybe you've already started work. So, how did you manage those things?
Yeah, well, the first thing I would say is I have had a long-winded relationship with the Crohn's and Colitis Foundation, the Northwest chapter, and they cover not only Washington State, but Alaska and Oregon, Idaho, Montana. So they have to cover a lot of space. And something that I want to do to help them, because they are a small team, is just to ensure that their message is, being spread across the state, but across the region. And I've made sure I've partnered with them and volunteered and been on planning committees for a lot of their fundraisers. I've raised a lot of money myself for the Crohn's and Colitis Foundation, because I know how important it is to have those resources, and some people don't have the access, and that's where the foundation meets people in the middle, and they want to help those patients. So that's kind of where my involvement started, besides just being a patient. Back when I was 16, when I first started attending events for the Crohn's and Colitis Foundation, but also, again, the University of Washington, having that group that I was able to connect with for those 2 years, just things like that, and even having a presence on social media, which everyone now has a presence on social media, but I'm able to have that medium, if I'm not able to connect in person, to talk about daily things that we all go through with IBD. So those are just a few things. And managing becoming Miss Pierce County, I do have to say I'm working full time. I'm trying to compete for the role of Miss Washington while being, a public figure in the Pierce County community. And it's been hard. And I think sometimes you have to make boundaries for yourself in order to take care of your health. And sometimes, I'm going to prioritize sleeping on this afternoon because my body just needs rest. It just needs 2 more hours of rest. Or one big thing, being a young professional, I went through college, and now I'm in a role where we do go to happy hours. And I actually don't choose to drink. I don't drink alcohol because I just know that my liver has been filtering things for so long. And I want to, promote a long, happy, and healthy life. And that's just a personal decision I've made, not saying anyone has to do that, but it's just something for me that some people don't understand when I'm in social situations, but I'm trying to promote a healthy body within my gut and my liver. And that's just a boundary I've made. And it's been great for me, but it's something that, I've thought about really hard because drinking is such a social thing. And that's another step I've taken to just be proactive.
That's really cool. How did you communicate with the people around you that, especially going into work when you have a lot of these social events, that I have this chronic illness and I mean, there are things that I tend to stay away from just because I'm a little bit more aware of my health, and then there's also kind of things that I can't do, right? How did you communicate that information to the folks around you?
So when I first started my job right out of college, I had the opportunity where my first manager ever, he was actually new to the manager role. He had just transitioned. So I was on his first team ever that he managed. And I was able to just say, hey, can we, hop on a meeting for 10 or 15 minutes? Just kind of want to talk to you about my needs. And he was super open, super flexible, which was great. But it was an opportunity for me to speak to someone who has never thought about a disease like this. And I was just able to introduce, this is what I have, this is what my needs are. I might work more remotely just so I'm, comfortable where I am. And although he hadn't been aware of the disease before, I knew I walked away that I could teach someone else who was never aware, and never been involved, okay, this is someone that I walked into in my life and more people could walk into it. And I was that first introduction. And that was an awesome moment for me to balance that. But really for me, it's just communicating and being willing to communicate with HR or my managers, but not everyone can do that or is comfortable with that. And so I would just say to be confident in yourself, put boundaries, write them down so you know exactly what you need, and you can communicate that with the important people in your work life and also in your social life.
Yeah, absolutely. I mean, I know that you work in tech, and obviously being in Seattle, I think, tech is such a big industry and has a big presence here. Actually, remind me again what you study in college.
Yeah, I studied something totally different. I was a pre-law major. I thought I was going to go into law school right away. And during COVID-19, I didn't want to go back and go into graduate school or get my law degree online. So I was like, you know what, I'll take a little bit of a break. But during that time at UW, I made sure I did different internships like marketing and sales so I could really diversify what I was learning about, which landed me a job in a software company, a tech startup here in Seattle. So I feel very blessed to be able to balance my disease, but also have such a cool work environment that is in the city of tech.
That's fantastic. So fascinating to hear your story on, going into tech, being a young professional female, also balancing, a very, like I said, IBD could have some debilitating impact, and you're also running for, running
Washington,
Miss Washington.
Yeah.
So that's a pretty busy lifestyle, right?
It
And
is.
you managed to kind of handle this or juggle these different things pretty well.
Yeah.
I mean, it's pretty amazing, and I think it's a very inspiring story to myself and to all the audience out there. So kudos to you.
Thank you.
Yeah. So could you tell us what your life and career aspirations are?
Yes, so we will see if I become Miss Washington in a few weeks. Who knows? There's 21 candidates. But after my role as Miss Pierce County, I would love to go back to school, go to graduate school. I studied, again, pre-law at University of Washington. And with COVID-19, I didn't want to go back to school in the midst of online schooling, and I wanted to have that real graduate program experience. So I'm hoping to apply in this next fall season, either go into business communications, PR, or I would love to do broadcast media. My passion has always been engaging with people and networking with people and just storytelling and connecting. So it's kind of weird. How do you bring that into a career, right? And so I've still been trying to balance that in my undergrad, but that's what I really want to do and go down.
That's fantastic. So before we wrap up the interview, is there any advice that you'd like to give to other young patients with IBD?
Yeah, for me, I think sometimes I'm really hard on myself with my disease, and I want to go all the time. And sometimes I forget, I normalize my disease a little bit. I'm almost too used to it, where I don't realize that other people aren't going through this. I've been dealing with it for so long. But for those who are maybe new to the disease, or they're going through a flare-up or kind of a battle in their journey of inflammation, when you're going through that, just know that the disease does not define you. I have always been someone that wants to do more, wants to learn, and I want to remind other people that despite their disease, despite Crohn's or ulcerative colitis or even IBS, you can do so much in your life and you're so capable. Just put yourself out there, and your disease makes you unique. It's an experience that not others have had, and you add an extra layer of that unique level that others don't have, and you have that experience and that perspective that only such a small group of people have. So in any life experience, just put yourself out there and never be afraid to go after what you want, because that's what I've been putting through my mind as I go into Miss Washington or being Miss Pierce County, that I'm an advocate for this disease and it's part of me, and I'm actually so thankful and feel blessed because it's changed my whole perspective on life. So as much as sometimes I wish, why me, it's really a blessing in disguise.
Yeah, I'm so glad that you're carrying this mission to impact the others. It's an incredibly inspiring and empowering story. I mean, I've always loved the term chronic illness warriors because it actually makes you stronger. I mean, sometimes it makes you weak physically, but it definitely builds up that mental strength. And Regan is such a good example.
Thank you.
So thank you for the time today, Regan. Really appreciate the conversation. Had so much fun.
Thank you, Victor. Thank you, everyone, for watching.
Thank you.